Hello everyone and welcome back to Clinical Cousins YouTube channel. Today we're going to go over the EKG machine and its leads. Specifically, how to do a 3, 5, and 12 lead EKG. Now first we need to know that the positive leads are essentially just cameras. Now these cameras are able to take pictures of the electrical activity that is going on in the heart. So basically the EKG machine uses either 3 or 5 or 12 different cameras or leads to take pictures of the electrical activity that is going on in the heart. Now it is important that we have different leads because they take pictures from different angles or views. Now the result after all these pictures have been taken is a 12 lead or a 12 picture photo album of the electrical activity of the heart that has been taken from all of these different angles. It is our job to learn what these pictures mean, but first we have to know where to place the leads. Now first we will talk about the limb leads. There are some basic rules that we should know. All of the limb leads should be placed at least 10 centimeters or about 4 inches from the heart so that they can take a clear picture. If not, the EKG will look all jumbled because it is either too close to the electrical activity. Now, there is a right arm limb lead, which is placed on the right shoulder. There is a right lower limb lead, which is placed on the right lower quadrant. There is a left arm limb lead, which is placed on the left shoulder. And there is a left lower limb lead, which is placed on the left lower quadrant. Keep in mind that all of these leads can be placed anywhere along the extremity. Now, what I tell people to do is just to make a box. That is essentially all we're doing with the limb leads, is we are just making a big box or square around the heart. Now we will talk about placement of the chest leads or the precordial leads. Now I'm not one who usually supports just straight rote memorization, but these lead placements need to be memorized. The precordial leads are labeled V1, 2, 3, 4, 5, and 6. Now before we begin, it is important to note that the angle of Louis will lead you to the second intercostal space. Remember, inter meaning between, costal meaning ribs, intercostal or space between the ribs. So what we need to do is simply palpate the upper third of your sternum until you feel a little indentation. Now slide your finger to the left or to the right of this indentation, and that space that you feel below is the second intercostal space. Now V1 is placed in the fourth intercostal space in the right parasternal area. V2 is placed in the fourth intercostal space in the left parasternal area. Now you will trust me just for a few minutes to skip V3. We will go on to V4, which is placed in the fifth intercostal space in the mid-clavicular line. V5 is placed in the fifth intercostal space in the anterior or front axillary line. And lastly, V6 is placed in the fifth intercostal space in the mid-axillary line. Now, come back to your V3 and just stick it in between your V2 and your V4. So, all together, what have we done? We've made a big box with the limb leads, and we've placed V1, 2, 4, 5, 6, and 3. Remember, place 3 last because it will be easiest. Now, I'm going to blow your mind with your own knowledge. A 3-lead EKG is made by doing our 2 upper limb leads and by placing the left lower limb lead. There you go. That is a 3-lead EKG. You already know where these go, and now we will use a 5-lead EKG, which uses our limb lead box and with a brown lead over the heart. That is it. Sometimes with our older EKG machines, you will see leads with just colors on them. Remember this song. White on right, snow over grass or green, smoke or black over fire or red with chocolate close to the heart. White on right, place the white lead on the upper right shoulder. Snow over grass, place the green lead below the white on the right lower quadrant. Smoke over fire, place the black lead in the left upper extremity, and place our red lead in the left lower extremity. And lastly, put chocolate or brown closest to the heart or in the middle of our box. Now, this is the 5-lead EKG song. You already know how to do a 12, 5, and 3-lead EKG. So lastly, let's review. We know that the 12-lead EKG placement means that we make a box with our limb leads, and then we place the 1, 2, 4, 5, 6, 3. Now, if you take the time to memorize these leads, you will be thanking yourself later on because the angles of the heart will just make sense to you. As always, thank you for taking the time to learn with us today, and remember to like and subscribe for more content.